This is Dr. Abdul Rahman Hakeem. I'm a consultant transplant surgeon at Dr. Rela Institute and Medical Center. I think the most important benefit the patients get after pancreas transplant is that they would be able to eat whatever they want. They don't need to have a strict diabetic diet which they used to do. They would not need insulin shots anymore, so they don't need to inject themselves, so there is no more needle pricks which is fantastic. I think our patients sort of extremely like when we say that they are not going to have injections anymore, and I think the fact that they are off dialysis with a functioning kidney transplant, it also means that they have an independent life, an active life. They don't need to go for dialysis sessions. So there is double benefit where they get completely free from sugar control, and also they're off from the kidney issues that they've had. Ask me why do we really need a pancreas transplant when you can continue on insulin? I think the most important thing that I feel is that a pancreas and a kidney transplant gives them not only the quality of life, which I said before, but also increases the quantity of life. If on an average, if somebody continues on a diabetic patient continues on dialysis, then their risk of dying is at least 3 times higher than if they get transplanted in the first year, and after the first year it's at least 6 times higher than those who get transplanted. On an average, studies have shown that those who get transplanted just with a kidney transplant with a diabetes and a kidney failure can stay up to about 15 years longer than those who are diabetic with kidney failure, and those who get both kidney and pancreas transplant live on an average at least about 22 years longer. So there's an extreme benefit with pancreas and kidney transplant. On an average, how long does these organs last? I think we say, it can last anywhere up to about 14 years on an average. So some patients can last even up to 30 years, and in some it might not last longer. From what data we've got in the West, we say that the pancreas transplant, first year survival following a pancreas transplant is anywhere around 97 to 98%. So if 100 people are transplanted with pancreas, 98 of them will be alive after 1 year, and after 5 years about 90 of them will be alive. In terms of the graft functioning very well, I think first year after the transplant there's a risk that 5 of them might lose the graft, and 5 years after the transplant there's a risk about 15 of them might lose the graft. So it's about 95 and 85%. So I think the outcomes from pancreas transplant have actually become much better than what it was in 1960s when it was first transplanted. Although it is much more popular in the West, it's not taken much precedence in India, and still there are only a very few centers which do pancreas transplant in India.